I'm your friend, Dr. Charles Apoki. There is a video that is making the rounds. A woman with stethoscope around her neck and with a medical attire was saying that men need to climb Mount Olives 21 times in a month to be able, in order to prevent prostate cancer. And then I saw a medical doctor on television during a health program interview that men needed to climb Mount Olives 21 times in a month before, in order to prevent cancer of the prostate. And I was thinking, 21 times in a month? Does he not have any other work he's doing? Climbing Mount Olives is very difficult and exhausting. It takes a lot of energy. And the synthesis spermatogenesis takes 74 days for a complete cycle. And the testicles are quite small. 21 days in a month consistently, a time will reach, the bank account will run dry. Even though there is the general belief that frequent emission of semen is good for the prostate because it removes toxins. But research by Patricio Gargolo, MD, of Mayo Clinic in the United States, suggested that there's no conclusive evidence that the frequency of release of semen has anything to do with prevention of cancer of the prostate. That there's no conclusive evidence. And that was some years back. But I later went to check a study of Catholic priests in the United States. 2,000 Catholic priests were examined, and it was found out that celibacy really had no effect on cancer of the prostate. In fact, one of the studies showed that there was a lower risk among them. They even did post-mortem, and they checked their death certificates. Death certificates of priests, 6,226 priests that died from 1965 to 1977. There was no conclusive evidence. Only 10% of them had cancer of the prostate. And by comparison to the general population, it was even lower. So the suggestion that men should be knacking every day for 21 days is not tenable. Number one, it will exhaust the man. Number two, there is no scientific evidence to prove. Number three, after some time, spermatogenesis cannot catch up with the rate of emission. And at a point, the man will only just be releasing seminal fluid. So, they did a research. What is the best? What is good for each man? They found out that there is no specific number of times a man should go to Jerusalem. But for those who are still having children, 3 to 5 times a week is good enough so that the possibility of fertilization would increase. They found out that cancer of the prostate is more among black males in America, twice among black males in America than white males. Also, research found out that if your father had cancer of the prostate, there's the likelihood that the sons will also have cancer of the prostate. In fact, I know a situation where somebody's father died of cancer of the prostate. 3 boys have been diagnosed with cancer of the prostate in the early stages, but thank God they were removed. A cousin died of cancer of the prostate. So there is the tendency that it can run in families among the males. Then the next thing is that it's usually commoner from 67 upwards. 67 upwards, but it can occur earlier. And so early screening is very important. Go do your PSA. PSA, if it is more than 4 and it is rising, then you should go for further screening, like maybe biopsy. Now, when you do a biopsy, as I used to advise my friends, when you do a biopsy and it is found out that there are cancer cells, particularly the arsenic type, try as much as possible to quickly remove the prostate. Because from my experience with people, it's like rain. You might think it will just drizzle, then suddenly it will just pour, and everywhere is flooded. Because once it bursts out of the capsule of the prostate gland, it's very difficult to manage. So the earlier the screening, the earlier the removal, the better. There are drugs that used to be available at affordable prices to be taken at every month, like Duodat. It used to be 12,000 naira in Nigeria, but it's now 52,000 naira. 52,000 naira. So if a man has to take it every day for a year, that's about 700,000 naira. But thank God, there are good surgeons in Enugu and Umuahia and several other towns that are now doing it with modern technology, and within a few days you are out of hospital and you are living a normal life. So the earlier the screening and the more seriously we take prostate cancer seriously, the better for us. Even if it is not cancerous, if it is still benign prostatic hyperplasia, still remove it. I remain your friend, Dr. Charles Apokin. I hope I sounded professional. This is 40 years one has been a medical doctor, and old guns still fire. God bless you. Subscribe to this channel, share it with others, particularly your males and your husbands.